Hello again, Dr. Michael Moulton coming to you from EpiClinic, our YouTube channel, Cosmetic Medicine. I thought today I'd spend a bit of time talking about dermal fillers. We kind of talked about the difficulty that people have in finding out about these things, and unfortunately I can't name any of these products. Can't even name what's in them, but I can talk in general terms at least. So there's 5 thereabouts manufacturers that are approved for use for dermal fillers in Australia. They're all really good. Some last longer than others. They're compatible with human tissue. They make up the largest number of dermal fillers that are used in Australia. Basically, they've got the same ingredient. Now, I can't even tell you what that is. But there are other products that don't have that same ingredient in it. They're based on other things, and they can be granular. They're used different ways, and they have their own side effects and complications which are more than some of the other products that we use. So I generally don't tend to use those at all these days. The product we use, I can tell you, has the lowest incidence of complications. And you need to know that there are potential complications with these things. That's why they're prescription-only medications, and that's why they're in our hands, because if ever you did suffer a complication, we would be able to treat that. It's okay to delegate that treatment to a trained, experienced, registered nurse, but the most important thing is that they need to be prescribed by a medical practitioner. So what we want to do with dermal fillers is replace some of the lost volume that we experience as we get a little older. We start losing support in the face, and we start to notice things like development of the jowls, nasolabial folds, downturning of the mouth, drooping of the eyelids and so forth. These are all areas where we use dermal fillers. Now, to reduce those risks that we talked about before, there's kind of special ways to use these dermal fillers to do that, to what we call mitigate any risks. And I'm holding in my hand here a device that we use specifically for that purpose, is to minimise the impact on the patient. It's called a cannula. It doesn't have a sharp point. We make a tiny hole in the skin with some local anaesthetic. And this passes through the skin, underneath the skin, and you'd be really surprised. It's actually just this weird sort of pushing feeling, but it's not painful. For the vast number of patients at least, very, very comfortable. The other great thing about using cannulas is that if there are blood vessels in that particular area, it tends to push them out the way rather than if it was a sharp needle to penetrate those blood vessels, and then we've got a big bruise. But we've also got potential complications that come out of those broken blood vessels. So we want to try and avoid that as much as possible, and that's why we use the cannula. Now, using a cannula is a skill on its own. You need a lot of experience to be able to use one of these things. It's not just jabbing someone with a needle. The great thing about dermal fillers is most of the time you're going to see results straight away. Now, I'll make an exception to that, and that is the lips. You can imagine there are lots of blood vessels in the lips. So I always warn patients about lip fillers. Be prepared for some bruising, and I have seen some pretty doozy bruises for lip fillers. So if you're having a birthday coming up, or some celebration, or you're going to go overseas in a couple of weeks, get your timing right, so that if you do experience those things, it's all going to clear up in that time. All right, so lips are very fleshy. It's not uncommon to get bruising, and you need a bit of time for recovery, so take that into consideration. The other thing is lips, as you can imagine, just sticking something into the lip could be pretty uncomfortable, which is why we use local anaesthetic to make that much more comfortable. Because when the patient's uncomfortable, I'm uncomfortable. How long do they last? Products that we use the products that last the longest, sometimes up to 2 years. certainly 12 months to 18 months. And sometimes we use 3 or 4 mils of product. And what I generally tend to do is to get the patient back in about a year. And instead of letting it all sort of run down and then go back to where you were before, or actually where you would have been if you had not had the treatment in the first place, just top it up a little bit. Instead of having that 4 mils or 3 mils or whatever it was that you started with a year ago, maybe we just need to use 1 mil. Just keep it going, just keep it topped up, keep that natural appearance. And that's the last thing that I really want to talk about here, and that is look better, not different. You know, the first thing that patients say to me when they come in for dermal fillers, you're not going to make me look like a freak, are you? This is the biggest fear. We've talked about this before in a previous video. We don't do that. It's look better, not different. Anyway, that's on dermal fillers. Don't forget to subscribe to the channel. Ask any questions that you want to. There's a lot of information that I can provide you just by asking the question. So looking forward to seeing you next time. See you later.